Hi, my name is Tonya Jacobs. I'm a family nurse practitioner student at Maryville University. I'm getting ready to do my HEENT assessment. I have Jaleesa here. She's with my patient today. She's over 18 years of age. Beforehand, we have done her vital signs. They are within normal limits. I also checked her vision using a Snellen chart, and her vision was 20/20. All right, so we're going to get started. So, Miss Jaleesa, I'm going to do another test to test your visual field, and it's called the confrontation test. So what I'm going to have you do is put your right hand over your right eye and put my hand over my left eye. And whenever you see my fingers come to the middle, let me know. Okay?
I can see it. I can see it. I can see it.
All right, so now I'm going to switch.
I can see it. I can see it. I can see it.
Good job. All right, so looking at your head, it looks normal cephalic. I don't see any masses or nodules or anything like that. Your face looks symmetrical too. I'm going to palpate. Your hair is black, evenly distributed. I don't feel any masses, nodules, or anything like that. Looking at your eyebrows, they are symmetrical, they're coarse, they're black, they extend out to the outer canthus of your eye. Your orbital region, I don't see any erythema or swelling or xanthemia. I don't see any crusting on your eyelashes. They are symmetrical and extend out to the outer lobes of your eye. I don't see, like I said, any styes or crusting or tearing or edema or anything like that. Can you open and close your eye for me? Good. So I'm going to palpate. Close your eye. Do you feel any pain?
No.
And I didn't feel any nodules, so that's good. Looking at your lacrimal gland, I don't see any extra tearing or discharge, so I'm going to palpate that as well. Any pain?
No.
Good. So I'm going to go ahead and have you look up for me. I'm going to check your conjunctiva. It is pink. I don't see any extra tearing or discharge or foreign bodies. Looking at your sclera, they're both, looking at your eyes, they're white. Your iris is brown. Both your eyes are symmetrical. Your pupils are round and symmetrical. So what we're going to do next is, and your cornea looks clear to me. What we're going to do next is I'm going to check your pupillary response to light. All right, so I'm going to shine a light in your face. Look at me. All right, your left pupil is equal and reactive to light. The right pupil was consensual. Let's do the other side. Good. So your right pupil was equal and reactive to light, and the left pupil was consensual. All right, so while I have this in my hand, I'm going to test your extraocular eye movement. So I'm going to have you follow my pen light with your eyes only, not with your head, okay? Good. With that, I didn't see any nystagmus or any involuntary eye movement or twitching or anything like that. Next, we're going to do the cover uncover test. I'm going to hand you this. I want you to cover up your right eye for me. All right, bring it down. Cover up your left. Look at me. All right, bring it down. I didn't see any nystagmus or any involuntary eye movements or twitching. All right, so now, Miss Jaleesa, we are going to check the back of your eye where your retina and stuff is. I will sleep on. I'm going to have you look at this on the wall here. I'm going to be coming close to your eye. So if you get uncomfortable or anything like that, let me know and I'll give you a break. Okay? And I'm checking your right eye with my right hand. Okay. Coming in at an angle, red reflex noted. Optic nerve is visualized, is well defined in yellow. The vessels and arteries are fine. I don't see any abnormalities. Look at my light for me. Macula noted. Okay, I'm going to come on this side and switch hands. So I'm going to use my left hand to check your left eye. Coming in at an angle. Right reflex noted. Okay, optic disc is visualized. It's well defined. Yellow. I see your arteries and veins. I don't see any abnormalities. Look at the light for me. Macula is noted. Right, good job. All right, so let's go ahead and look at your ears. So your ears look symmetrical to your head. They're not low set or anything. I don't see any discharge or nodules or masses or swelling or erythema or anything like that. I'm going to palpate. Any pain?
No.
Good. Any pain in your mastoid area?
No.
All right, so I'm going to use the otoscope and look in your ear just to make sure your eardrums and all that look okay. I'm going to pull your auricle up and back. External canal is free of foreign objects and no erythema noted. Tympanic membrane is pearly gray, positive light reflex, and landmarks noted. So good. I'm going to check the other ear. I'm going to pull the auricle up and back. Sneak in there. External canal, noted to have a little bit of cerebrum over here. No foreign bodies, no erythema. Tympanic membrane is pearly gray, positive light reflex, positive landmarks noted. So good job. All right, so I'm going to continue to assess your hearing. I notice you've been answering my questions appropriately, which is good. So what I'm going to do is call it the whisper test. So I want you to go ahead and cover up your right ear, and I'm going to whisper 3 things, and I want you to repeat them to me.
Apple, orange 2. Apple, orange 2.
Good job. So we'll cover up your left ear now.
Grape, banana 1. Grape, banana 1.
Good job. All right, so another test we're going to do is the Weber test. The Weber test has the hearing as well. So I'm going to hit my tuning fork here, and you're going to hear it vibrating. I want you to let me know when you no longer hear that vibration, but also let me know if you hear it in both ears or just one ear.
I'm here.
Good. All right, so now we're going to do test your bone conduction versus your air conduction. So it's called the Rennie test. So I'm going to put the same tuning fork behind your mastoid process area, and I want you to tell me when you no longer hear it. Once you tell me that, I'm going to move it to the front of your ear, and I want you to tell me when you no longer hear it. I'm going to use the clock here to time myself. Ready?
Here. I hear.
Good. Air conduction was 2 times greater than bone conduction, which is awesome. Do the same thing over here.
Can't hear. Can't hear.
Good job. The same thing on that ear. Air conduction was 2 times greater than bone conduction, which is good. All right, so now let's take a look at your nose. It looks symmetrical to the rest of your face. I don't see it deviates one side or the other. I don't see any masses or anything like that. It's not red. I'm going to take a look inside your nostrils here. Back for me. All right, so each nostril, I don't see any nasal discharge. It's pink, it's moist. I do not see any septal deviation or perforations or even polyps, so that's good. I'm going to palpate your nose. Tell me if you feel any pain.
No.
Okay, good. I'm going to palpate your frontal and your maxillary sinuses, so let me know if you feel any pain. Any pain?
No.
What about here in your maxillary area?
No.
Okay, so no pain on the frontal?
No.
And no pain on the maxillary? No. All right, good job. So let's look at your lips. Your lips are symmetrical. I don't see any edema. I don't see any cracking. I don't see any lesions or nothing. They're pink. All right, so I'm going to look with my lights here, look inside your mouth. Open your mouth. Oral mucosa is pink. I don't see any lesions on your cheeks or masses or anything like that. Looks like you have all your teeth. I don't see any dental caries. Hold your tongue out for me. Your tongue is nice and pink. I don't see any fissures. Can you hold your tongue to the side here? I don't see any masses or cankers or anything. Look on the other side. Nope, no masses or cankers. Hold your tongue up. All right, vessels look fine. Go ahead and hold your tongue out again and say ah, ah, ah. Uvula is midline. 1+ for tonsils. The soft and hard palate are soft and moist. They soft and pink. There's no erythema or anything like that noted. Okay, so I'm gonna actually let me have you move to check your cranial nerve 12. Let's have you move your tongue from side to side to the other side. Good job. And last but not least, let's check your gag reflex. It's always not the fun part. Okay, hold your tongue out. All right, good. All right, last but not least, let's wrinkle your forehead, puff out your cheeks, stick out your tongue, and smile. Checking those cranial nerves. All right, so this is the end of my presentation. Thank you.